Hello dear students, welcome to the session. Today we will deal about the nutrition in pregnancy and lactation. The main objective of this session is to know the importance of nutrition before pregnancy and to know the physiological changes, complications during pregnancy and to know the nutritional requirement during pregnancy and lactation, and the other objective is to know the impact of nutrient deficiencies during the pregnancy and lactation. And apart from this, we learn about the dietary guidelines that has to be followed during the pregnancy and lactation. A woman who has been well nourished before conception begins her pregnancy with reserves of several nutrients. So, the needs of the growing fetus can be met without affecting her health. Whereas, if the mother starts her pregnancy without reserves, naturally the mother nutrients will be depleted from her body. Once pregnancy occurs, various physiological events bring major changes to the mother's body, creating an entire new organs within it, the placenta, umbilical cord and amniotic sac. So, during the pregnancy, the baby's development depends on the placenta, umbilical cord and the amniotic sac. The placenta is a disc-shaped network of blood vessels which is attached to the uterus, and umbilical cord is the one which attaches placenta to the baby and transfer the nutrients to the baby. Amniotic sac is a bag of fluid that encloses the fetus and protects it from injury. A poor store of nutrients in pre and early pregnancy leads to formation of small placenta. Small placenta is very essential to draw the nutrients from the mother. So, when the placenta is very small, it can't draw the nutrients and inhibits the growth of the fetus. Thus, a healthy placenta is essential for the developing of fetus to attain its full potential growth. Pre and early maternal nutrition is very essential for the placental development. Better nutrition intake later on will not alter the placental size. Therefore, the newborn will be small in size and weak. Malnutrition exerts its effect during critical periods of development. The intense development and rapid cell division are critical periods. Critical because the events were scheduled for that time can occur only at that time. If cell division and final cell number achieved in an organ are limited during a critical period, full recovery will not occur. Early malnutrition can have an irreversible effect which may not become fully apparent until the person reaches maturity. Research suggests that adverse influences at critical times lead to chronic diseases in adult life. For instance, the beta cells of the islets of Langerhans are increased in number by 130 times between 12 weeks of fetal life and birth of an infant, which is primarily determined by the nutritional status of the mother. Infants who are malnourished have a less number of these cells, which leads to diabetes in the future. Thus, each organ or tissue is vulnerable to nutrient deficiencies during its own critical time. For example, the critical period for the formation of neural tube, which is the beginning of brain and spinal cord, is 17 to 30 days of gestation. Any state of undernutrition, especially low levels of folic acid, can cause a major defect in the nervous system. These critical periods occur throughout pregnancy. A woman should continuously take good care of her health. By 12 weeks, most of the major organs like liver, kidney, intestine and lungs as well as limbs are formed. Though the fetus is only 9 centimeters long and weighs 14 grams only. Thus, pre and early nutritional status is very important. Now, let us see the physiological changes during pregnancy. Usually there will be increase in basal metabolism 5% in first trimester and 12 to 15% in second and third trimester. Increase in BMR leads to increase in weight and high metabolic activity of fetal and placental tissue. Increase in thyroid function increases the BMR. Gastric tone will be decreased, therefore nausea and vomiting are common during the pregnancy. There will be decreased ability for the taste of salt because there is increased requirement of sodium during the pregnancy. And there will be changes in the renal function, especially the glomerular filtration rate is increased and waste products are cleared very fast. Water is excreted at higher rate in mid pregnancy and at lower rate in advanced pregnancy. Increased loss of free fatty acids, and there will be a decreased loss of calcium and B complex vitamins. There will be changes even in blood composition. Plasma volume increases by 50% resulting in apparent decreased levels of hemoglobin, and red cell mass increases by 20%. The concentration of hemoglobin and packed cell volume falls despite increase in total hemoglobin. This is called as the physiological anemia of pregnancy. Therefore, the normal hemoglobin level in pregnancy is 11 grams per deciliter, and there will be increase in total serum tocopherol, keratin and cholesterol levels, but there will be decrease in total serum protein. Coming to the water balance, total body water increases by almost 7 liters. This places stress on the kidney for disposing of water. And there will be hormonal changes, especially the progesterone prepares inner lining of uterus for implantation of fertilized ovum, and it also relaxes the uterus muscles so that the mother will not feel pain during the expansion of the uterus. And gonadotropins, another hormone which deal with the organ formation of fetus till the 4th month. Next one is the estrogen, which will increase after 3rd month, which helps and stimulate the growth of mammary glands. Steroid hormone levels also increase and help in retention of water and sodium. Weight gain in pregnancy. It is better to start pregnancy when the woman's BMI is between 20 to 26 because maternal and fetal complications occur at both extremes. Majority of women have marked increase in thirst and appetite. Morning sickness may initially counteract this increased appetite. Consumption of non-food items like laundry starch, ice cubes or clay is called pica. It is a temporary phenomena that disappears after delivery. Normal pregnancy is associated with a weight gain of 11 to 13 kgs. So, normal woman should gain at least 12 kgs to have an healthy baby. Increase in weight is due to weight of fetus. The weight of fetus will be 3 kgs 300 grams and weight of placenta 650 grams. Increased uterine and mammary tissues 450 grams. Water retention, decreased extracellular fluid 1000 grams. Amniotic fluid 800 grams. Increased blood volume will be 1250 grams and fat stores of mother will be 4000 grams. Most of the weight gain is during 2nd and 3rd trimester. The pattern of the growth will be by 10 weeks the pregnant mother will gain around 650 grams. By 20 weeks the mother gain about 4 kgs. By 30 weeks around 8.5 kgs. By 40 weeks 12.5 kgs. Low weight gain leads to delivery of low birth weight baby. Next, complications of pregnancy. Usually morning sickness is a very common phenomena. Nausea in pregnancy may be due to nervous disturbance, placental protein intoxication or due to derangement in carbohydrate metabolism. Morning sickness of early pregnancy can be improved by small and frequent meals. Liquids may be best taken between the meals and not along with the food. Skim milk is better tolerated than the whole milk. Fruits and vegetables can be given. Fatty foods, excessive seasoning, coffee in large amounts and strongly flavored vegetables should be avoided during this period. Disturbance of physiological and biochemical balance and production of excessive hormones leads to gastrointestinal upset, loss of appetite, nausea and vomiting by certain foods and excessive fluids. So, morning sickness can be relieved by using high carbohydrate foods, dry foods, small and frequent meals, fluid intake between the meals and avoiding the deep fried and fatty foods. The pressure of the enlarging uterus on the lower portion of the intestine in addition to the muscle relaxant effect of placental hormones on the gastrointestinal tract and decreased physical inactivity may make excretion of feces difficult, resulting in constipation. Increased fluid intake and use of natural laxative foods such as whole grains, dried fruits, other fruits and vegetables rich in fiber and fruit juices usually induce regularity of bowels. Laxatives should be avoided. Regular habit of exercise and sleep are essential for proper elimination. Overweight. Pregnancy is a period of excellent appetite which may lead to excessive weight gain. It may lead to complications during delivery and may increase the incidence of toxemia. Excess calorie intake should be restricted, but nutrients should be balanced. Calorie intake should not be below 1500 kilocalories. No weight loss program should be taken up during pregnancy. Anemia. Physiological changes in blood. Hemoglobin mass increases, RBC volume increases, plasma volume increases by 50%. As plasma and the hemoglobin will not increase proportionately, it leads to anemia. Hemoglobin concentration drops from 13.4 to 11.6 grams per 100 ml, which is considered to be normal during pregnancy. Severe anemia increases morbidity and mortality. If hemoglobin falls below 8 grams per deciliter, it leads to very low birth weight due to increase in prematurity rate, intrauterine growth retardation. Several anemic pregnant women require therapeutic doses of 120 to 200 milligrams of iron. Therefore, 60 milligram of elemental iron and 500 micrograms of folic acid is administered orally in the last trimester of pregnancy, and oral therapy may be continued for 3 to 6 months after the anemia is corrected in order to replenish depleted stores. Anemia due to vitamin B12 deficiency is very rare in pregnancy. A single injection of 40 micrograms of vitamin B12 is administered to mothers who is having vitamin B12 deficiency. Next, pregnancy induced hypertension. Severe pregnancy induced hypertension is associated with higher incidence of vitamin A and protein deficiency, resulting in poor pregnancy outcome. It is common among women subsisting on inadequate diets and poor prenatal care. The symptoms include hypertension, edema, albuminuria and convulsions or coma. Diabetes mellitus. Glycosuria is common in pregnancy because of increased circulating blood volume and its metabolites. Most women revert back to normal glucose tolerance after delivery. Edema and cramps caused by pressure of enlarging uterus on veins returning fluid from legs, sudden contraction of muscles and decline in serum calcium levels leads to the calcium phosphorus imbalance. No sodium restriction or other dietary changes in normal edema is recommended. Sodium restriction is not recommended unless it is advised by the doctor. Heartburn. Common complaint in later part of pregnancy is heartburn due to effect of pressure of enlarged uterus on stomach results in regurgitation of contents of stomach into esophagus. To avoid this, small frequent meals should be eaten, limiting the amount of food consumed at one time, drinking fluids between the meals, sitting upright position after meals will avoid this heartburn. Food cravings and aversion. Craving and aversion towards certain foods or urge towards specific foods is very common during pregnancy, especially towards the sweets and dairy products, and the aversion will be towards the alcohol, coffee and other strongly spiced foods. Weight gain during pregnancy. Optimal weight gain is about 11 to 13 kgs. About 900 to 1800 grams is an average gain during the first trimester. Thereafter, 450 grams per week during the remaining period of the pregnancy. Coming to the nutritional requirements of the pregnant mother. Additional energy around 350 calories is required to meet the growth and physical activity of the fetus and for the growth of plasma, normal increase in maternal body size, additional work involved in carrying the weight of the fetus and extra maternal tissues. Protein. Normally the protein requirement is 55 grams, whereas during the pregnancy 23 grams of additional protein is recommended to meet the rapid growth of the fetus. Protein is required for enlargement of uterus, mammary glands and placenta to meet the increase in maternal circulating blood volume and subsequent demand of increased plasma and maintenance of colloidal osmotic pressure, circulation of tissue fluids. Protein is also required for formation of amniotic fluid, transfer of amino acids from mother to fetus up to 20 weeks. If protein requirements are not met during pregnancy, there is increased risk of pregnancy. Maximum growth of baby cannot be obtained. Number of cells in the tissues, particularly in the brain, may not be achieved. If the protein is not supplied adequately, the division of the cells will be limited, especially in the brain and in the mammary tissues. So, protein can be supplied through the milk, meat, egg and cheese. These are the complete proteins with a high biological value. Fat requirement is 30 grams per day. Calcium is very essential for the calcification of fetal bones and teeth, for protection of calcium depletion from mother to meet the high demands during lactation. Mother diet should contain less of phytic acid, adequate amount of vitamin D and sufficient amount of calcium to prevent osteomalacia and muscular cramps. Mother should avoid repeated pregnancies. Normal iron requirement is only 21 milligram per day, whereas for the pregnant mother it has been increased to 35 milligrams per day, because infants are generally born with hemoglobin levels of 18 to 22 grams per 100 ml and they are also born with iron stores in the liver. Iron is also required for the growth of fetus and placenta. To achieve these, to meet all these requirements, the iron requirement is increased to 35 milligrams per day. This iron is also required for the formation of hemoglobin, as there is 40 to 50% increase in maternal blood volume. More of iron is required not only to meet the fetus requirement, but also to meet the blood loss during the delivery and for the increase of blood volume and to meet the obligatory losses. So, iron rich foods like green leafy vegetables, eggs, liver and dry fruit should be included in the diet. During pregnancy, there is an increase in extracellular fluid which calls for 80% increase in body sodium. When blood sodium level drops, kidney produces the hormone renin, as a result of which sodium is retained in the body. In case of edema and hypertension, sodium is restricted. Iodine. ICMR recommends additional requirement of 25 micrograms of iodine per day during pregnancy. Iodine deficiency in mother lead to abortion, stillbirth, congenital anomalies, increased perinatal mortality, cretinism and psychomotor defects. ICMR has recommended total 14 nutrients as an extra allowance for the pregnant mother, such as energy, protein, fat, vitamin A, vitamin C, apart from this minerals like iron, calcium, even the B complex vitamins. The list was given in table. Dietary guidelines. Small and frequent meals should be taken. Avoid fasting or missing any meal. More fiber should be included in the diet to prevent constipation. Diet should be rich in calcium to prevent osteomalacia. Calcium supplements also can be taken. Iron rich foods should be taken to prevent anemia and to build up iron stores in fetal body. Iron supplements can be taken. Diet should contain optimum amount of sodium. If edema or hypertension prevail, then sodium should be restricted. Inclusion of green leafy vegetables daily ensures minerals like calcium and iron. Plenty of water should be taken to keep the bowel movements normal. Fatty foods, fried foods, excessive seasoning, strongly flavored vegetables may be restricted if nausea and gastric distress are present. Fluid intake should be between the meals rather than along with the meals. Adequate amount of calories should be taken so that enough fat is deposited during pregnancy, which can be utilized for lactation. Let us see the impact of nutritional deficiency on pregnancy. Energy and protein deficiency leads to the mother may not able to gain enough weight to have a normal lactation. Ketosis. In infant, it may lead to low birth weight, premature birth. Next one is calcium. If the calcium is deficit in diet, it leads to muscular cramps. In fetus, it may decrease the calcification of bones and teeth. It may lead to underweight. Coming to the iron, if there is deficiency of iron, it leads to hypochromic microcytic anemia, whereas in the baby it may lead to less stores of iron, which again leads to the anemia. Iodine. Iodine leads to increased risk of miscarriage and stillbirths, whereas in the fetus there are chances of getting cretinism. Zinc leads to fetal mortality. In fetus, it leads to retardation in intrauterine growth and it also leads to low birth weight and preterm baby. Vitamin D. When there is deficiency of vitamin D, it leads to decreased absorption of calcium, and in the fetus the calcium metabolism may be affected. Vitamin K, it leads to decrease in prothrombin synthesis and increased loss of blood during delivery, whereas in the fetus it leads to increased risk of neonatal hemorrhage. Folic acid. When there is deficiency in folic acid, it leads to megaloblastic anemia. In the fetus, it leads to malformation and neural tube defects, abnormalities like palate, low birth weight. Vitamin B12 leads to pernicious anemia in mother and premature baby. Coming to the nutritional requirements of the lactating mother. Lactating mother needs additional nutrients to meet her daily needs and to provide enough nutrients for the growing infant and to furnish energy for the mechanism of milk production. Diet of lactating mother and her nutritional status during pregnancy affect both the quality and quantity of breast milk. Nutritional needs are more during lactation compared to pregnancy. By the 6th month, a normally developing infant doubles its birth weight. Sometimes infants fail to thrive while breastfed due to maternal and infant causes. For lactating mother, extra 600 kilocalories were recommended for first 6 months and 520 kilocalories during the next 6 months, that is 7 to 12 months. These additional calories were recommended based on the quantity of the milk produced and the energy required for the mechanism of milk production and the conversion of the dietary to milk energy, and also keeping in view of the deposition of the fat during the pregnancy. During lactation, 25 grams of protein was recommended as extra during the first 6 months and 18 grams for later 6 months. This recommendation was derived based on the quantity of the milk secreted and the conversion of the dietary protein to the milk protein. Total 30 grams of visible fat is recommended during the lactation period. Though the total amount of fat in the breast milk is not influenced by the mother's diet, the composition is more important, that reflects the composition of the mother's milk. Maximum of nutrients are required during the lactation period than the pregnancy, and the number of nutrients are the same as in pregnancy. Lactating mothers also needs the same nutrients as in pregnancy, but only the iron is not recommended because during the lactation amenorrhea will be there will be no menstrual cycle. So, the iron requirement will be same as for the normal woman. Nutrition requirements are maximum during the lactation than any age group. Diet should be balanced to meet the requirement. Number and frequency of meals can be increased. Sucking is the best lactagogue. Lactagogue is the one which stimulates the milk production. Dietary lactagogues can be used like garlic, milk, garden cress seeds can be used. To increase milk secretion, goat, meat, fish, mutton can be used. Special foods like sant laddu, gond laddu are traditionally used, and such practices should be encouraged. During lactation, constipation and dehydration are the common problems. To control the constipation, use of raw or cooked fruits and vegetables, whole grains, adequate fluids should be used to avoid the constipation. And no food should be withheld during the lactation period unless it causes distress to the infant. Irritability of gastric distress, example coffee, tomatoes, onions may cause distress. During that time, such type of food should be avoided. If mother has rapid weight loss while breastfeeding, that indicates that calories are not sufficient and the calorie intake should be increased. So, today we learned about the importance of nutrients during pregnancy and lactation. Adequate nutrition before pregnancy and during pregnancy is at most important. Any nutrient deficiency during the pregnancy or before birth leads to the chronic diseases during the adulthood. That is why nutrient plays very important role during the pregnancy period. It not only during the pregnancy period, even during the lactation also it is very important, otherwise the mother health will get affected. So, adequate nutrient supplements is very much essential during the pregnancy and the lactation to maintain a good health of the mother and the fetus.